Great. Welcome, everyone. Thanks so much for your patience. We're so excited to have everyone joined in for this webinar presentation, specifically on the role of kind of law enforcement and service providers. I'll have Doug introduce himself in a minute. He can tell you more about himself. If you hear some thunder, disregard, it's just where I am. And hopefully the internet works with me on it and the power doesn't go out. But I'll just briefly get started in the name of the Father, the Son, Holy Spirit. Saint Josephine Bakhita, as a child you were sold as a slave and had to spend untold difficulties and suffering. Once freed from your physical slavery, you found the true redemption in your encounter with Christ and his church. O Saint Bakhita, help those who are trapped in slavery, intercede on their behalf before God, so that they are freed from the chains of captivity. May God free anyone who has been enslaved by man, provide relief to those who survive slavery, and allow them to see him as a model of faith and hope. Help all survivors to find healing for their wounds. We beg you to pray and intercede for those who are enslaved among us. Amen. Father, Son, Holy Spirit. Let's see. So we're gonna be recording this webinar and uploading it, so it will be available for all those that are interested in viewing it after or weren't able to attend, especially other registrants. We wanted to kind of make this more of an engaging webinar where I kind of just navigate a little bit of the conversation here with Doug while we wait for Amy. But feel free to. We are hoping that you all engage through the Q&A chat. So feel free to ask questions as we go. I'll be monitoring the chat as well to kind of see how we can answer all those questions. Feel free to drop in the chat where you're from, what agency you work for, where you're tuning in from all over the US. And I think here we have Amy. Welcome, Amy. Thanks so much for being here. We're having some issues as well on my end in terms of there's a big thunderstorm, but we'll kind of get started. Doug, would feel free to introduce yourself, and then we can move on to Amy to introduce herself as well.
Sure. So my name is Doug Gilmer. I am a veteran of about 35 years, just a little more, in law enforcement. Spent about the last 25 years working for the Department of Homeland Security or one of its predecessor agencies as a special agent. And I currently serve as the senior law enforcement advisor and liaison to the Department of Homeland Security Center for Countering Human Trafficking in Washington, D.C. Although I'm retiring the end of August and am on leave. So I am here kind of on my own time today and having more of a personal rather than an official conversation. But in my role at the CCHT, a lot of the work that I do revolves around strategic planning and policy initiatives, implementation of national strategy, national policy, DHS policy, that kind of thing into the work that we do. But I've been working human trafficking and exploitative crime for a very long time, kind of throughout my career. As a matter of fact, my first case was before we even had an actual TVPA. And then I've also done a lot of work in the field of international human rights violations and war crimes. But I'm very passionate about working with nonprofits and NGOs. I'm a firm believer in collaboration, public-private partnership, and the role of the faith-based community in the work that we do.
Great. Thanks so much. Amy, I see here that it says the chat is disabled, but please feel free to put it in the Q&A. I'm trying to find a way to enable the chat because we can see them here. Amy, please, if you wouldn't mind introducing yourself as well.
Yes, thank you so much. Hi, my name's Amy Nace-Dagonda, and I'm going to apologize too because we've had a really big storm and a transformer was hit, so internet is very questionable right now. So I apologize if I somehow hop off. But I work with what's called the Bakita Empowerment Initiative through Catholic Charities of Louisville. So we are based in Louisville, Kentucky, but we are actually a statewide program. And we provide direct services to survivors of both labor and sex trafficking, male and female, foreign-born and domestic, of all ages. We have two main facets to our program. The first is doing the direct services, working with participants to connect them to resources and provide support. And then we also do prevention education for youth throughout the state. And we also do training and awareness throughout the entire state too, to kind of increase people's idea and understanding of what trafficking is, how to report it. I myself have been with the agency for 10 and a half years. I started out as a case manager, and I've kind of slowly moved my way up. But I've been working in the realm of anti-trafficking for about 15 years because I started volunteering on a task force and doing outreach and awareness. And have been in social services for a total of 24 years.
Great, thanks so much. I see here, I think I enabled the chat. So, okay, I see people typing in the chat here. Okay, that's great. Thanks, Amy and Doug, for being here. Someone said here to you, Doug, congrats on your retirement. God bless. So that is great to send some of that messages. And I see everyone tuning in from California and different areas, Milwaukee. So thanks so much for joining us all. So we kind of wanted to just kind of navigate a conversation here. Amy and Doug, are you guys able to turn on your video, or does it not let you?
It is not letting me.
It's not letting me.
Interesting.
I don't know if you or Tony could maybe resend the panelist link.
Okay, let's see if yeah, let me try and do that.
And then we could jump off and jump back on.
Okay, let me.
And I'll give you an email, or here we go, join as a panelist.
Okay, did that prompt you? Amy, you as well? I think I made you.
I attempted to join as a panelist earlier, and then it wasn't sending me the confirmation in my email. So I'm almost honestly hesitant to jump off because my internet.
Okay. Yeah, and so I just got the panelist link. But I tried to start the video and it says you cannot start the video because your host has disabled it.
That's so weird. Oh my gosh. Okay, let me try and do some stuff here. Let's see. I made you a co-host. Does that let you? I see you now, Doug.
Yep, now I'm here. Yep.
Okay, Amy, you as well. Oh my gosh. Okay, great. Thanks. So sorry, everyone. Thanks for your patience. What's a webinar without some technical difficulties? Okay, great. So I think everyone here, we're all good. Okay, we see everyone. Everyone can see? Okay, good. All right. So the first question we had was, how are services in law enforcement and service providers, how do the services differ and how are they similar? So whoever wants to go first, please do.
I think our common, oh, did I stop? Sorry. Okay. I think I froze for a second. I think our common goal is very much similar, right? It is to help those that have been trafficked to access stability, right? Whatever that may look like for them. The goal is to get them out of the trafficking situation and keep them out of the trafficking situation. And so, I'm not going to speak, Doug, to law enforcement because you know that better than I do, right? But, for service providers, we are just we do long-term connecting them to resources, supports that are going to continue their road to stability, whatever that may look like. I will let you talk about law enforcement, kind of
Right. No, I mean, you're absolutely right. I mean, we each kind of have our own lane on the interstate, but we're both driving in the same direction with the same destination, right? And that's really what it boils down to. Um, at the end of the day, the goal between law enforcement and victim service providers should be to build shared purpose between the two entities. Even though we may have different objectives, at the end of the day, we all have the same mission, the same purpose. I think I mentioned when we talked, a week or so ago, um, in the research um, that I did a few years ago, um, one of the end goals of that, or one of the key themes was that of shared purpose, and that of the goals of the victim service provider should be the goals of law enforcement, and the goals of law enforcement should be the goals of victim service providers, and we need to be working together, and assisting each other in achieving that mutual benefit.
And so, we've worked a lot with law enforcement. So law enforcement might actually, if they are investigating a situation, or doing like an operation to find a trafficker or those that have been trafficked, they invite us alongside of them sometimes. So we won't be in the operation, but we may be back at the police station or wherever, so that when they bring somebody that's been trafficked, they're being connected immediately to a victim service provider to, have that kind of support, and, to do like more of the long-term services. And the other hand is sometimes we have participants who are, like involved with law enforcement or with a case, and we kind of help them navigate that system. We'll go with them, to just provide that support. Because sometimes it's, people might feel like overwhelmed, like talking to someone, having to talk more about what was going on, their experience. And so just having somebody right next to them so we can provide that advocacy. If somebody we work with wants their situation to be investigated, then we will connect them to the law enforcement that we work with.
Yeah, and I'm a big supporter of having service providers alongside law enforcement on these operations. Um, Obviously, not going through the door when we go through the door, or that kind of thing. But it's absolutely essential to have that service provider there to hand the victim off to. And because, I mean, let's face it, a lot of times they don't want to talk to law enforcement. And I've seen countless numbers of victims that we've put with a service provider. They figure out that they're not law enforcement. They're often surprised that they're there as a volunteer, and they're not getting paid to be there. And it kind of changes the dynamic. And really, that service provider ultimately, for law enforcement, down the road, might not happen immediately, but down the road, a few weeks, a month later, they're really that trust broker. When that survivor, trusts the service provider, and the service provider trusts law enforcement, it helps to broker, mutual trust between each of the parties.
Yeah, absolutely. And I think that role of that service providers kind of bring in is that role of like a companionment, right? That being
Right.
able to kind of advocate. Amy, could you kind of distinguish a little bit of the difference between like the victim advocates, maybe, or both of you could probably tune in on that, maybe that are brought when the cases or trials start or something like that, um, between victim advocates and victim service, kind of victim assistance providers?
So, in my experience, with working in like with the FBI, with local law enforcement, HSI, so they will all have victim advocates that work, on the law enforcement side. So they kind of help them navigate, but their, main goal, I was just talking to a victim advocate with our local police department that we were doing something on Sunday with. And, she was talking about how it's like their job is to kind of respond immediately and then connect to those long-term services. So advocates, coming in there for the law enforcement victim advocates, they're in there for that immediate right? And they may work with them for a little bit, but then they're handing them off to the victim service providers that are going to work more long-term and that can provide
Okay.
more of the resources.
Yeah, absolutely. So for both of you, I think you touched on this, but what would be some non-negotiables in providing services? I think, or what do you see as like the biggest need? Would that be, housing, um, mental health services, kind of, food? What are the kind of more immediate needs that you both have kind of experienced? And then what are those kinds of non-negotiables when providing services, both in the perspective of law enforcement as well as service providers?
So what we are seeing, we're seeing a really big trend and in housing being a very big need. And if you don't have housing stability, it's really hard to have stability in other areas. Like job stability, food resource stability, sometimes just like having a sense of community stability. It's really hard to have. But a lot of times it is like just those very basic needs. So housing, food, medical, we're seeing a lot more where people are having medical debt, sometimes due to their trafficking situation, and that is causing the inability to be able to pay other things, which puts them in vulnerable positions. And so with our program, we look at looking at what's the most immediate need to be met. So when we get a referral, we look at that. What's the most immediate need? So for some people, I'll give an example because I was working with somebody last week and their immediate need was they were leaving the hospital. If they didn't get into some other place, they were going to be returning to a very unsafe situation. So we met the immediate need by placing them in a hotel. Right. So they didn't have to return. But it could very much mean that they just need a connection to one resource or they need a toiletry bag.
Sure.
And then we're looking at that more longer term. And do you mind, I'm sorry, to like explain what do you mean by non-negotiable? So I have a better
Yeah, I guess
understanding.
more of like what is when providing services, probably non-negotiable would be, like a victim-centered approach, right? A trauma-informed care approach. I think I was just recently speaking with some people here, and a lot of the issues that we've been seeing or some of the trends that it's, law enforcement is trying to find out, how to prosecute a certain case or get information from the victim, and then maybe service providers are also trying to get information, but sometimes it feels, victims kind of lack that question of, how are you, right? What do you need right now? And focusing on them and feeling kind of maybe manipulated by law enforcement, or not manipulated might not be the right word, but it's like they're again being asked to provide something, when sometimes it goes back to like that root core of, how are you, what can we do for you? And so as the service provider, what is that, maybe that first question you would ask to a victim, and what are those like standards of care? I think for both law enforcement, right, and service providers, right, the first thing you do, do you have a house? Do you have food? Do you have safety, security, and all these things? Maybe that differs for both of you. So I was just curious on kind of that, what I would say a non-negotiable, maybe
Yeah, I mean, I know for us, one of the biggest needs for law enforcement, I think, nationwide, and this is borne out every year, in tip reports and everything else. But one of the biggest needs is that immediate housing, that immediate stability, a place that we can take a victim where they can receive care, so
Mhm.
that we can get them stable. Um, I think from a long-term perspective, something that we need to do better at, um, is, and it's not an easy fix. And again, it's a long-term solution, but I think we need to do better at also providing education and job skills, for
Sure.
survivors, once they're out of a trafficking environment, because otherwise, if they can't make a living wage to support themselves, maybe support their family, they get their kids back, whatever the case might be, and they can't make money. um we run the risk of them going back to maybe
Their situation.
their last way they knew how to make money. And so I think that that's something that, we need to, do better with. As far as non-negotiables are concerned, absolutely, victim-centered trauma-informed practices are key. At DHS, that is, and within HSI, that is our policy. It's not a guideline, it's not a suggestion. It is a policy for us, and we spend a lot of time training our people on what it means to be victim-centered and trauma-informed. And that, being victim-centered and trauma-informed doesn't mean, as an agent, that you're weak or that you're soft. It actually makes you better. And it's sometimes it can be kind of a hard sell to law enforcement, but once they get it, it tends to make perfect sense, because they see the outcomes, from doing things from a different perspective.
So for us, non-negotiables, going into that person-centered approach, empowerment approach.
Yep.
Like the minute somebody walks through the doors of our program, we are, presenting a person with choice, because a lot of times when they've been trafficked, their choice has been taken away from them. And we have to look at what is best for that person, right? And who's the only person that can say what's best, and that is that person. So we want to ensure everything that we're offering, it is presented as a choice, because just because I've been in social services for 24 years does not mean that I know what's best for that person. Am I going to have, I'm going to have resources for you, and I'm going to tell you why I think this resource is a good fit. However, if it's not where you need to be at that moment, right? Like I think a lot of times you'll see programs where therapy is a requirement. But if a person is not ready for therapy, then that actually will have more of a negative effect. And they know whether they're ready or not. And we need to listen to them and understand that they're the experts of their life. You should not have like a one size fits all for your programming, because each person is an individual and each person has individual needs. So we need to respect that. We, do it as making sure a person is informed as possible. So if I have a resource, I am going to tell you, this is what this resource is. Here may be the negatives to it. Here are the positives. We do that about our own agency, right? Here's what's great about Bakita, and here, this might be helpful for you. Actually, here might be some of the things that might not be so helpful to you, so that each person can make the most informed decision that they can. We do a disservice to a person if we are not giving them all the information. If we are just building up a resource because we think it sounds good for them, without identifying. We have had at times, some resources that might not be so great, right? Like that we know in the community might do some harmful practices. However, it's not for me to keep a resource from somebody, but what I will identify is, these are the things you can get at this resource. Here are some of the things that I've heard that might be problematic. And then you are able to decide whether that is something that you want to pursue.
Yeah, absolutely. That's really helpful to kind of frame in that way. I'm having some connection issues on my end, so I'll just keep my video off for a bit. Hopefully that smooths the process out. But to kind of, I think, Amy, we spoke about this last time, but what role do people have in supporting communities, or what agencies and law enforcement to combat human trafficking? You mentioned kind of the role at the local level. Could you elaborate a little bit on that? And Doug, you as well, on what role maybe common folk or agencies have in supporting the efforts to combat trafficking?
So I think it's different for community members versus professionals. When you have professionals in the community that might be coming across someone that's being trafficked, or might be able to provide those services, it's for those professionals to be trained on what they may see in regards to trafficking and the best way to respond, right? Are they responding specifically? Are they calling law enforcement? Are they calling the National Human Trafficking Hotline? Are they calling one of, your local trafficking agencies? What is it that they can do, right? And then the community, and I know a lot of community members want to jump in and they want to be able to connect but that's not necessarily the most beneficial. You have people that are trained to work with trafficking survivors, that are trained to, like be able to identify what they need or to provide those services, or referrals. And the community, the best way that they can support is to support the agencies doing the work. And that looks like a lot of different things, because what we really need to be doing in the trafficking, in the anti-trafficking field and in the communities, is to help to decrease all of these like root causes. And I'm going to say something that's going to make everybody feel overwhelmed for a second, but I promise I'm going to shrink it down for you. That we're looking at root causes of homelessness and poverty, racism, all of the gaps that we currently have in our systems, those things that create those vulnerabilities in a person, right? Those populations that may not have all those protective factors. And the community, the way that they could really, kind of help to build those protective factors, which leads to decreasing a risk for being trafficked, is, shrinking that and looking in your neighborhood, in your communities. What are some of the gaps that you may be able to see that you could build up? I'll give an example. So in Louisville, we have community ministries. Each zip code has a community ministry. And in those community ministries, they are there for those areas to provide food resources, resources for housing, clothing, really to provide some more protective factors for the people in their agencies. So could, each zip code provide, like fundraising or volunteering for those agencies, right? You're looking at what can you do to strengthen your neighborhood and your community? And those things have a ripple effect, because one family that goes to that community ministry and is able to get a food box that month and have their rent paid for, that creates a protective factor that could lead to longer term stability. So the community, has a part to play in providing support to these types of resources.
Yeah, absolutely. I think it's a really interesting way to frame, right? When we, decrease all these risk factors and, bring up more protective factors, that creates, community safe outlets or parks where young, children can go to that are safe and secure, that kind of empowers the community to have more safe outlets and bring up, prevention and these difficult conversations and whatnot, and just help kind of protect. Doug, what do you, I don't know if you have anything on that.
I I echo everything that was just said. I think um I mean, obviously human trafficking is a global issue. So there's nothing wrong about thinking globally. But we have to act locally. And starting in your neighborhood, on your street, on your block. I think that's really the model that we need to follow. And I love that idea of having a community ministry in every zip code, because then we have the opportunity to touch everybody. And we're not excluding anybody um, that might otherwise kind of get left behind.
Right. Yeah, absolutely. So there's a question here, would you both, for both of you, maybe the victims that you served prior, Doug, or Amy, that you are serving now, and I'm sure that, this varies by obviously state, but at the national level, is there a group, age/gender, that is most at danger? And I think that that varies, right, for labor trafficking and probably sex trafficking and whatnot, but maybe you have some more specific insight.
I mean, I can tell you based on my experience, and I mean the numbers, the statistics bear this out, but um, the vast majority of sex trafficking victims that we encountered are U.S. citizens,
Mhm.
born and raised in the U.S. The majority, but not all, labor trafficking victims are foreign nationals. Um, their vulnerability typically is their immigration status, right? Or lack of access to English language. And so they're easily exploited. Um, Obviously, there are some push-pull factors. There are some risk factors for different age groups and that kind of thing. But I I try and steer people away from stereotypes when it comes to a trafficking victim, because I've seen too many I've seen too many victims from all walks of life, from all levels of society, um, and at the end of the day, the only thing all trafficking victims have in common is a vulnerability, and that vulnerability can be just about anything. And but we've been conditioned to believe that the trafficking victims look a certain way, or they live in a certain neighborhood, or they dress a certain way, they go to a certain school, whatever the case might be. And really, that's not the case. And if we get too focused on the stereotypes, then we tend to overlook sometimes what's most obvious, but overlooked in plain sight.
And I think
Yeah, absolutely.
sorry.
No, no, go
And I think we have to remember that, like this issue of trafficking, is still really young. And so the data is still struggling to catch up, right? So, I don't know that we even have the most accurate data. You have to think about that. Not every place is identifying trafficking that might come across it. People, kind of talking about like Doug, that there's not a stereotype, but most people are going to think that if somebody's being trafficked for sex, it's a female, right? And so they're not capturing the fact that, males are trafficked as well. They may look at it as something else. So we're still working on that, trying to figure out the best way to capture the most accurate data. And we're unfortunately not there yet. And our organization, we just really work on capturing the data that we have, and then those public facing data. So like HSI, the data that they put out, our community-based services put out data every year, but there's so many agencies that might be coming across it and they just don't recognize it. So it's really hard to see.
Yeah, absolutely. And then, you know, this is a kind of an interesting question here, but when an incident of trafficking is witnessed outside of the US while on vacation, how would you, go about it? What are some ways maybe? I would presume you would both say, to reach local law enforcement wherever you are in that country. But I don't know if there's maybe some other, tips or insight that you both have.
Don't approach.
Yeah.
Don't approach if you witness it. That, could put yourself or the person that's being, trafficked in danger. And I agree with the contacting local law enforcement, but it may also, if you have the ability to maybe even just do a simple Google search of like how that country, like their recommendations for response to trafficking.
Yep.
Yeah. And you can also contact the US Embassy, or the consulate, the closest consulate to wherever you are, because they'll have a law enforcement liaison that can report that information to the local authorities, and begin working on it that way too.
Great. No, that's extremely helpful. Um, Another question here. We have worked with adults and minors who are exploited and have found 95% of them do not identify as victims of sexual exploitation for months, if not years. Has anyone created an approach for support without using labels or titles?
We mimic the language that the person gives us.
Mm-hmm.
So, if, we work with them, kind of slowly and understanding what, the situation, that they may have been in. But, if they identify their situation as, being like, treated badly by, a significant other, and talk about the trafficker in terms of like, boyfriend or parent or whatever. We just mimic the language. Because putting a label on things can be incredibly overwhelming. And it's not like even when somebody comes in and we do a screener, we're like, well, you're a victim of trafficking.
Right.
We, kind of just identify in the beginning what our program does and what we're, kind of like why we're screening and this is what we do. But, it's not our practice to just kind of label it and like their situation is trafficking or them as a trafficking survivor.
Yeah, and some
Right.
of that is cultural too. You have diaspora communities in the U.S. Where you will probably never get someone to identify as a trafficking victim. Um, the good thing is, I mean, we don't, and yes, sometimes it can take years before the the light switch clicks and they think, oh yeah, I was a victim of human trafficking. Um, but we don't necessarily have to have someone tell us I'm a trafficking victim. Um,
Right.
Oftentimes we're pretty good at figuring that out, and figuring out the elements, and they don't have to come into court and say I'm a victim of human trafficking. That's not the way it works. It's not the label we put on it so much as it is the elements of the crime, of the exploitation.
Yeah,
Certainly
absolutely.
for providing victim services. For instance, if we have a foreign victim that we encounter who has no lawful immigration status in the United States, um, they're eligible. At least initially, we can provide them with an immigration benefit called continued presence, um, and the bar for that is really low. They don't have to disclose to us that they were a victim of human trafficking. It's up to us to make that determination. If we have reasonable belief um, that they are a victim of human trafficking, we don't have to have proof. We don't have to have an arrest. We don't have to have a prosecution. We can grant them that benefit. Um, and the same thing for a T visa, trafficking victims visa. We don't have to have a successful prosecution. We just need to be able to say, yeah, you know what? At the end of the day, maybe the case fell apart. We couldn't go forward, but they were in fact a victim of human trafficking based on our assessment. That's what matters.
Right. Absolutely. Yeah, and I think, yeah, you both like aimed at that point of, you're not going to have someone come and say, knock on the local police department and say, hey, I am a victim of trafficking. That rarely happens. Um, but it is kind of measured in the different ways with evidence and kind of as working through and I think a lot of times that doesn't right, that doesn't kind of delay or they still get services for the other reasons of identifying need and all these other issues. So kind of moving on here, how to establish the level of trust and focus on uniting goals with law enforcement and service providers. How would a local agency maybe, or they want to start a program or they want to maybe get involved and be able to support on trafficking at the local level, you know, how could agencies, collaborate with other agencies, maybe to not reinvent the wheel, as well as to say, we don't really have a partnership with law enforcement or local PD or, community organizations because of our nonprofit or because of um because we're new to this or something, how would you encourage people to focus on building that trust or capacity with local agencies slash law enforcement?
Well, I mean, I think you hit the nail on the head. It begins with trust. And I don't think in most places you're probably not going to get a lot of pushback um, by offering to help. The issue is going to be establishing that level of trust, because it's not going to happen overnight. The best research we have tells us it takes 2 to 5 years to build a sufficient level of trust within an organization, within a team, before people and groups can effectively work together. And so a lot of it's baby steps. Now, sometimes that time can be reduced if you already have pre-existing relationships. People on the PD, the chief gets on board. Maybe you go to church with the chief of police or whatever. Sometimes you can expedite that process a little bit, but I think a lot of it really begins with small steps. And I tell NGOs and nonprofits all the time, when they ask me, how can we, and especially faith-based organizations, how can we get on board with law enforcement? How can we help them? How can we gain their trust? How can we establish rapport? This might seem awfully simple, and you might laugh or you might giggle at this. But one of the best ways, easiest, fastest ways to establish rapport and trust with law enforcement is through their stomach. And if law enforcement has an operation going on, maybe it's not the right time for you to come on board and ask if you can participate in that operation because the relationship is too new. But you can always have pizza delivered to that operation. You can bring by a big tray of Subway sandwiches. You can bake cookies. You can bring by a cooler of drinks and boxes of chips and snacks. I guarantee they won't forget that. That is one of the easiest ways to get your foot in the door. That, and then once you do get your foot in the door and you make a commitment to help, don't go back on your word. It takes 2 to 5 years to build a sufficient level of trust. Once trust is broken, it takes even longer to reestablish it.
Yeah. And I agree with Doug on the small steps. It really is small steps. It's setting up a simple meeting to introduce yourself, what it is you're doing, how you can be of service, and then thinking about the different ways that you can collaborate. Another thing I would suggest is if somebody is kind of looking to get involved, are there local coalitions or task force in your area that are focused on human trafficking? Are you able to join that? Because then you can meet all of the other different agencies that are involved, and then find ways in which you can collaborate and add to the work that's being done.
Yeah, absolutely. There's a question here about if either of you have heard of the On Watch program, and if you would recommend that as a good training source. I will say, I know DHS has available training. They have kind of, representatives that will go out locally to do trainings if that's a need. USCCB as well does some trainings with on this issue. And I don't know, Doug or Amy, if I know, Amy, you might do some trainings as well, maybe at the local level, if people, what are some good maybe agencies or programs or curriculums that you have all seen that you would probably support or share?
So I recommend looking at OVC, Office for Victims of Crime. They have a lot of trainings on trafficking, both labor and sex trafficking. They have a pretty extensive library. They even have their VAT, which is a victim assistance training. So that working on being a victim assistance provider. So I would recommend those.
Yeah. And I put, in the chat, dhs.gov/blue campaign, tons of free resources and training on there, interactive training for just about every age group and just about every profession. So whether you're a healthcare worker, you work for a faith-based organization, you're in law enforcement, you own a convenience store, a hotel, you're involved in the transportation industry. All of those resources are on there, and they're absolutely free to anybody that wants them. A lot of those resources can be downloaded and accessed just right online, but a lot of those we actually have hard copies, printed material that we'll send you for free. And I think at least some of those resources we have now, and I think about 43 different languages. So
Yeah, the DHS has kind of that resource library where you can order, I think like pamphlets and brochures and things like that, which they send to you for free. And that's always seems to be really helpful to have these like PSA kind of, at your agency or, your organization. So I put those links in the chat for people that are curious, the OVC training and DHS kind of library as well. So our last question is, what are some ways to measure success with both of your capacities, right, with as service providers and as law enforcement?
So I think for service providers, you have to kind of throw out your idea of what success looks like for you, right? Because you're working with individuals and each person is going to have a different measure of success. So we don't measure success as like an overall, this is how we know our program is successful. We measure it by each participant that we serve, and did that participant meet the level of stability they wanted to when they came into our program and they identified what they wanted to do. What did that look like for them? Were they able to connect to those resources and supports and find the stability that they were looking for? And that's going to look different for each and every person. So there's not like one black and white, I think, like, level of success. It's going to vary.
yeah, and I can tell you that from my perspective, and really kind of from a DHS HSI perspective, our number one priority is always the victim. As a matter of fact, when we do an investigation, we get the same as an agent. We get this, and granted, we love to arrest people. We want to put traffickers in prison, but we get the same credit for recovering a victim and providing services to that victim as we get if we make a successful prosecution. They've taken away that idea that the only way we have a successful case is if we make a successful prosecution. The victim always comes first. And I can tell you that from a research standpoint, when I did my research, a few years ago, and I was talking with collaborative multidisciplinary teams around the country that were working to help counter human trafficking. I was interviewing law enforcement and I was interviewing victim service providers. And I actually asked this question, how do you measure outcomes? How do you measure success? Law enforcement overwhelmingly said their number one answer was victim stability. That's how law enforcement measured success. It was the number one answer for victim service providers as well. But there was a huge margin of victim service providers that also said prosecution, much more than law enforcement. Now that also goes to the same idea that your goals are my goals and my goals become your goals, right? We're working together. But at the end of the day, it's really victim stability.
Yeah, absolutely. Well, great. That was kind of the end of our discussion here. If anyone else has any questions, please feel free to put them in the chat. This is recorded, so it will be uploaded, and we can include those links to Amy's organization, as well as some of the other links that were asked around here for the resources and trainings. In the meantime, we have a fun fact about Doug here that he has a picture with Mother Teresa. So yes, you have to tell us the fact that you told Amy and I about Saint Teresa.
Yes. So I actually served as her bodyguard
Yes.
on her when she came to the US for the last time. So certainly one of the highlights of my career. Just an incredible opportunity to spend a lot of time with her. And the fun fact was that she loves strawberry ice cream. And she was very funny in the way that she talked about strawberry ice cream, and that she didn't want yogurt. She didn't want fat-free strawberry ice cream or diet strawberry ice cream. She wanted real strawberry ice cream. And so we were very good at supplying ice cream, which of course she would share with everybody. Not It wasn't just for her, but she would share that with everybody.
That's great. That's a motivation to not have fat-free strawberry ice cream.
Exactly.
If a great saint was doing it, we can all do it.
Yeah, full fat.
Yeah, exactly. Well, thanks so much, everyone, for joining on. Doug and Amy, we're really so grateful for your expertise and insight to be able to share this with people that hopped on. Thanks, everyone, for your patience. It's been, technology can always do it to us. And Amy, be safe with the thunderstorm I think you have over there. I just drove through a tropical storm as well. So, great. Thanks so much. I put my email in the chat for if if anyone has questions or concerns. I will be sending out the recording to everyone and it will be uploaded as well. So great. I hope you all have a blessed week/weekend. And stay safe.
Thank you so
Sounds
much.
good.
Thank you, Doug.
Thanks.
Thank you.
Yeah.
Thanks.
Have a good one. Bye,
Bye.
everyone.